everybody. Welcome back. So this is our weekly class together on everything related to medical English. This is class, well, I'll go to the slide in a second. I think it's our third class out of 6. So we're just about halfway through the program. So tonight will be all about how to conduct medical examinations. So you may be asking yourself, wow, is Ariella really authorized to tell a doctor or a medical professional how to conduct medical examinations? And the answer is no, I most certainly am not. We are doing medical English. So the whole class tonight is going to be dedicated to what phrases we use, what are the vocabulary that we have in the context of medical examinations. All right, this is me. I'm Ariella. I'm the founder and CEO of the American Institute. I'm from Boston. I'm an English teacher, and I have been living in Algeria now for 6 years, or almost 6 years. All right, so today we are on session 3, conducting medical examinations. So you can see that we have a 6-week course. This is an entirely free course offered in partnership with the U.S. Embassy. We are offering classes every Sunday night, but these are recorded. As you can see, we're recording right now, and they will be posted on our YouTube page for viewing after the fact. So if you miss a course, you can always watch it later. We have gone through kind of overall basic medical terminology. We've talked about communication skills, which was largely focused on doctor to patient communication strategies, best practices, things like this. Today, we're going to go into conducting medical exams. What is the language that we use in this specific context, largely between a doctor and a patient who's coming into a non-emergency situation and needs to communicate what's going on. Then we have next week is going to be our pharmaceutical focused course on prescriptions, medication. Then we have a mental health focused course, and then a research and conferences course. So I'm excited to have you all here with me. This is just details about the course. I've already shared some of this, just talking. I skipped the slide because I think I said most of it. The classes are free. They're offered online. Oh, this is every Wednesday night. That is not true. This is every Sunday night. Every Sunday night, we are doing medical English, and this is the YouTube page. So anyone can come to these courses. Maybe you're a doctor. Maybe you're someone who's just interested in free English classes, but you're more than welcome here. Oh, I see a few people in the chat telling me they haven't found the previous classes on YouTube. Yes, we have a delay in uploading, but I have been promised that they should be uploaded this week. So I'm really sorry that you haven't been able to catch up yet, but by the end of this week, everything should be online, courses 1, 2, and 3. Thank you for your patience. Course rules: stay appropriate in the chat, stay on topic, and participate actively, please. This is the disclaimer that I laugh because it's the only class I've ever had to give a disclaimer for. Can you see what I'm seeing? Good. Which is that I am not a medical professional, but sometimes even in the language I'm using, it sounds like I might be giving medical advice, saying, well, as a doctor, you should say this, or as a doctor, as a nurse, you should say this, but please do not get it confused. I'm giving you language feedback. Here's what we consider appropriate for a doctor in an English-speaking setting. I'm not giving medical advice. It's also important to think about how language and culture are very closely related. And so I am often telling you, in English, a doctor says, or a doctor should show empathy, or we expect our doctors to show empathy. We expect these kinds of questions. This is what we want out of that interaction. So in that moment, maybe I'm not sharing explicit language like vocabulary, but I am showing culturally from the English-speaking world, this is what we expect in our medical environments. Of course, the English-speaking world is huge. So I would just make sure that you take what I'm saying and you relate it to where I'm from. So my experience is North America, United States, and Canada. You're going to find differences everywhere you go in the world. In the English-speaking community, you have India, you have the United Kingdom, you have Australia, and then you also have English as a medical language in a lot of countries where English is not even official language. So if you're going into the Netherlands, for example, you would find English-speaking doctors wherever you go. But their culture, the culture of the medical appointment, will be more dictated by Dutch culture than by English-speaking culture. All right, this was a long disclaimer, but I think it's important because I'm imagining someone coming onto this course later and saying, well, Ariella is talking like she is a doctor. And that is not my intention. So I'm actually always hopeful and grateful for any medical professionals who join the chat, who can fill me in on where I am right and where I am wrong. Let us begin. What are we going to tackle this session? Just to make sure that your fingers are near the keypad, you're awake, you're ready to learn with me. I'd like you to tell me in the chat, what is a synonym for tackle? What are we going to tackle this session? Give me a synonym. If it's your first class or you're new to this, I often ask for you to participate. And while you're not on video with me, you are in the chat with me. So I want you to write in the chat the answer to my questions. Great, I see we are awake. So I have talk about. What are we going to talk about this session? What are we going to discuss? Very good. What are we going to follow or keep up with? I don't love follow or keep up with. They're close, but not exactly the same in meaning. I like discuss the most. But of course, talk about and discuss, it's practically kif kif. I like this because this is a verb that we use in any kind of general English context, but we especially use it in an educational context or a training context like the one you're in right now, where you're going to be learning about conducting examinations. We also can use tackle in a medical context if we're talking about tackling a disease or tackling an illness, where it would be more used as in to treat, to defeat. Okay. Yassine wants to know, are we going to tackle patients? I hope not. I hope nobody is tackling a patient. In case someone doesn't get the joke that Yassine is making, this suggests physically tackling someone, which is a move that you'd see in American football, that you'd see in rugby. I guess in soccer, you can say they tackle. It's illegal. Also, maybe you can't say they tackle. Like in American football, tackling is actually a specific move that you are trained how to do. The coaches will train you to tackle, where you run up to someone and using your body, you want to knock them completely over. So yeah, it's called tackling. All right, enough about tackle. Today, we are going to talk about medical histories, how to understand medical histories, formulating a diagnosis, okay? Formulating a diagnosis for an illness, communicating a diagnosis, and communicating a treatment plan. These are the 4 areas. Everything will be around basically how do we communicate in the context of a medical exam. Diagnosis. Who can tell me what is a synonym for diagnosis? Actually, that's a hard one, a synonym for diagnosis. Maybe explain it. What do you think diagnosis means? And I will never know if you just very quickly Google it and send me the Google definition. And maybe actually we might even have the Google definition. But if you have an explanation in your own words, bring it on, challenge yourself. How would you say this in your own words? Okay, we have know the disease from the symptoms. I like that. We have saying the disease the patient has. Cool. Determining the anomaly. Okay. Something about how is a pathogy we are talking about. Pathology. Okay. Determining the pathology of the patient. Okay, that sentence I understand a little bit better. The sum of the examination, getting to know the problem. Beautiful, beautiful. Anything else? What a disease is from the symptoms, finding the problem, making a decision about the illness. Well, I would, oh, did my slide change on you? My slide has changed on me. Ah, okay, good. No, it should be fine. Find the disease, analyze the symptoms to find the disease and treat it. Okay, beautiful. So I think you explained it better than I could ever have, which is great because we don't even put a definition. Well, okay, we have a very short one. Very basically, to diagnose is to identify the cause of an illness. So I said we didn't put a definition because in fact, we defined the verb, but not the noun. So if you put together everything that you gave me and you put this definition together, we should have a very clear image of what is a diagnosis and what does it mean to diagnose. What are the essential steps to formulating a diagnosis? So we have taking medical history, performing a physical exam. Now, this can be many different types of exams, but they are generally examining the body of the patient. Order diagnostic testing. Here we're talking about blood work. We're talking about maybe urine sample, stool sample, right? Anything that we will send out to a lab to have tested. And then summarizing the data to deduce the diagnosis. I see Yusra saying, we don't always know the cause. Absolutely, absolutely. We are trying to diagnose the patient's illness, but it does not necessarily mean we will be successful. Amina, great question. Is there a difference between saying exam and examination? There is not. Examination is simply the longer way to say it. So I would say it's less common. Normally, we just say exam. I know tonight I'm saying examination a lot, and I think it's because I'm feeling like the teacher of the class. So I'm giving you the longest way to say everything. But examination and exam in the medical context are synonyms. When you are talking about, I'm hesitating here, but I think this is right. To me, in a medical context, exam and examination, totally fine to use one, the other. In the same sentence, you can change between them and it's fine. But in an academic context, we would not call a test, like a student's test, we would not call it an examination. We would only say it's a test or it's an exam. So in an academic context, you can have a test, an exam, or well, I guess that's it. I have a test today, I have an exam. Sometimes we say a final. If it's the end of a session, we call these finals. It's a short way of saying final exam. So I have a final, I have a test, I have an exam. That's not medical. That's an academic context. So in an academic context, you cannot say examination. But I should say not never, but we don't hear it. In medical context, this is why we don't hear it in academic, because examination, the full word, feels very medical to us. So you can choose which one. All right, what is the difference between, well, this one, I have to tell you, this question, I don't know how you will know this. This is how we will know if we have a doctor in the room. The question is, what is the difference between a differential diagnosis and a single potential diagnosis? I'm just here teaching the vocabulary, friends, because when I saw this, I thought, I don't know if anyone's going to know the answer. Do we have any doctors in the room who would know the answer to this? If not, no worries. I have it on the next slide and I will teach you. If you want to try to guess, maybe send some thoughts. Like, what would you say? I'll say this. You can logically understand what these are, even if you've never heard of this. So just send some guesses my way. What do you notice about the terminology here? What does it suggest to you? Okay, similar symptoms. Maybe it has something to do with similarity. Differential diagnosis is what we eliminate different possibilities of an identified illness. The first is more frustrating, says Amina. So Amina suggests that you are yourself a medical professional, okay? Differential diagnosis is like many diseases, sharing similar symptoms. Okay, all right. We're sort of dancing around it, and I think some people are maybe have their finger on the nose, which is what we say when we mean they are correct. I mean, that's a good idiom. I'm going to put this in here. Someone has their finger on the nose. means they have the right answer. Oops. Okay, so again, this I learned when I was making this presentation. So a differential diagnosis is a list of possible conditions that could be causing a patient's symptoms. Okay, so let's say you are suffering from migraines. Differential diagnosis is going to have a possible, maybe it's stress, maybe it's a brain tumor, maybe it's blood sugar related. So that's when you have a lot of possibilities. Single potential diagnosis is when a doctor comes to a conclusion about what they truly believe is causing the symptoms. So I believe the ones in the chat, I think we have some medical folks here and you had it right. So single potential diagnosis can be the diagnosis, but we're not sure. It's true. I want you to notice that even in the single potential diagnosis slide, we have the phrase most likely, meaning it's not confirmed. It's just that the doctor has eliminated other possibilities, possibly after diagnostic testing, after looking at patients, taking a patient's medical history. At this point, the doctor will come to a single potential diagnosis in order to move forward, saying this is the one that looks truly the most likely. Can you see the screen I'm showing you? Do you see a quote on your screen? I've been having some trouble with my screen sharing. Can you tell me in the chat? Do you see a quote? A picture of two men? Beautiful. Thank you. So we have a quote here. Just listen to your patient. He is telling you the diagnosis. What do you think it means? What's the point of this quote? Just listen to your patient. He is telling you the diagnosis. Interesting. Yassine says the patient holds the key. Tell me more. Active listening. The patient is the one who knows his illness the best. Interrogation is the key. I think what you mean, Sarah, which is interrogation in English is very forceful. To interrogate someone is kind of what we do in prisons. We interrogate till we get answers. So in English, what's a better word than interrogation? Listening, asking questions, something like this. This is what you want. Let's see what else we have. It means it's very important to listen to patients. Pay attention to the patient's clues. Okay. Listening and conducting a good analysis, maybe. We do half the job. The patient's assessment is key. The patient gives you details about the symptoms of the disease. What is this word I now see repeated twice? Anamnesis. Yassine says a good anamnesis, and Zaina says good anamnesis. Is this a typo or is this a word that you're teaching me? Oh, this is a word you are teaching me. Anamnesis is a medical term meaning asking questions. Wow, I have to say this is the very first time I've encountered that. So I am also learning some medical English in my very own medical English class. What I can tell you is that this terminology has certainly not made its way outside of the medical community because I've never seen this. So let's imagine if you're speaking with a patient or you want to use what we talked about last week, which is layman's terms. Give me layman's terms for this, anamnesis. I thought 100% it was a typo for the word analysis. What would you say? I want the same idea that anamnesis, when you do a good anamnesis, the patient gives you the diagnosis. Replace the word anamnesis. Maybe it's something that in French is commonly used, but I have never heard this word in my life. So maybe the doctors are using it between each other, but they're certainly not using it outside of that context. Taking a medical history. Awesome. Thank you, Yassine. Taking a medical history. Now, this is very common. This is what we talk about, and we'll talk about it later when you and I mean, again, I'm imagining myself as the doctor in this scenario, but the doctor and the patient are discussing, and the doctor's ability to take an accurate and complete medical history of the patient will mean a lot for the accuracy of the diagnosis. So it sounds like the best synonym, sort of layman's term synonym for anamnesis would be taking a medical history. Okay. Very interesting. All right, so I agree with your feedback that essentially what this quote is talking about is that oftentimes we think that the diagnostic testing, the blood work, maybe the CT scan, the MRI, all of these different tests are going to tell us the diagnosis. This quote is reminding you that actually the conversation with the patient might be the most telling, where the doctor will learn the most about what kinds of tests need to happen. Will be better equipped to detect an anomaly just off of the conversation. Great. Excuse me. In order to come up with a diagnosis, you need to ask questions. Sorry. In order to come up with a diagnosis, screen sharing is very small. How is this? Can you see this? Better? Okay, but tell me, can you see my full screen or just the slide? If you see the full screen, you'd see kind of a second window behind it. Medical history only, one slide. Okay. Okay, good. All right, so as we were saying, in order to come up with a diagnosis, you need to ask questions and practice active listening. So let's talk about understanding a medical history. So here we have an acronym that I think some doctors are using, but I have not heard of it very commonly, again, because I'm not a doctor, but I included it because it sounds nice, and maybe this is common. Past medical history, so PMH. Social history, family history, and current medications. So tell me, what do you think it means when we say past medical history? Past medical history. Because I see someone as saying it means personal and family. Okay, but we have a separate one that says family. So what would it mean to just isolate it to medical? Okay, previously treated diseases, previous illness, if he had the same symptoms before. I accept all of these. Thank you, Sarah, Yassine, and Marazga. Family, I think I've read genetic disease, family genealogy diseases. So I would call these genetic diseases. I'm going to put that in family history. That will be in family history. Previous surgery, Zaki, thank you. And Yusra and Wisdom, yeah, same thing. Past treated conditions, great. So past medical history is going to be the actual, let's say, diagnosed illnesses, any current conditions that the patient still suffers from, and any previous surgeries. So in this kind of conversation, let's say someone is having migraines in my same example, you would ask them, have you ever had migraines before? And maybe the patient will say, actually, I used to have them when I was young and then they stopped. So that's the past medical history. They'll say, have you had any major surgeries where you went under anesthesia? Maybe the patient says, well, yes, actually, I had my appendix removed. Okay, this is the medical history. Great. Social history. What are we going to define as the social history of the patient? What does that mean? Social history. I have social state. life conditions, social background, work, age, name, gender. Mohammed is informing me that there are big differences between medicine in Algeria and the US. For example, Algerians do not have a family doctor, just those who have chronic illnesses. Interesting. Okay. It's true in the United States, we have something called a general practitioner or a GP. And a GP is the family doctor or just the doctor that you see once a year where you check in with them. Social history, living conditions, if they're married, where he lives, where he lived, children, marital status, family situation, life level, environment, toxic habits. Any more? Work, life situation. Great. Yes, I think you've understood basically the lifestyle of the patient. So when we say lifestyle, we're largely talking about, let's say, eating habits, general healthiness. If we're looking at a specific diagnosis as well, we would try to figure out if it was related to something happening in that person's life. So if they're talking about migraines, you can say, what do you do for work? Are you very stressed? They say, maybe it's someone who's a lawyer. Oh my gosh, okay, so a very stressful job. Could this be related? So the doctor is not simply asking about the physical body in terms of what are the past illnesses that you've had, but they're also trying to understand what could be happening in this person's life that's triggering this outcome. I think this is probably where you see a lot of TV shows. I'm thinking specifically of House, which I shouldn't even quote because I have not really seen it. But I think this is the one about the brilliant doctor who, based on something really small that the patient mentions, like, oh, I went to the zoo last weekend. And then the patient like magically realizes, oh my gosh, this is an allergy to the ostrich that's only in this zoo. And, this is kind of what TV shows love, is connecting small details in the patient's life with diagnoses. I see others talking about education level or academic level. So I think absolutely like understanding, really it's about understanding who you have in front of you. So yes, of course, we're trying to take a diagnosis, but at the same time, you're also trying to work with someone to understand what kind of person they are, how you can communicate as a medical professional. How can you communicate best with this patient? Great. Family history. We already had some answers that I moved into the family history section. So tell me, family history, what do I mean? All right, already some answers. Good. Hereditary diseases, genetic diseases that run in the family, familial diseases like cancer, genetics. I see someone saying disease in the same family. Okay, so maybe this person gets migraines. They'll say, do your parents get migraines? Is that something that you've had you've heard your parents complain about? Okay. Chronic diseases, illnesses in the family, genetic diseases. Okay. So one thing I want to be clear about, chronic diseases, when we say let's say someone's interviewing me, I'm the patient, I'm talking to a doctor. If they ask about chronic illness or chronic diseases, that is only about my life. That is about me. Do I have a chronic disease? Do I have something that I am suffering from? That doesn't have to do with family illness, okay? That's about the patient. But the other answers, when we're talking about family history, genetic diseases, sometimes we will hear the phrase, I'm gonna put it in the chat, genetic predisposition to a certain disease. So a predisposition means likelihood, that you have an increased likelihood. So a genetic predisposition, for example, we often find it with diabetes, or we find it with cancer, or we might even find it with some mental health diseases. So if your mother had breast cancer and you're a woman, you have a genetic predisposition to breast cancer. It means you have an increased likelihood. And so based on the family history, the doctor will often recommend a certain, either a more or a less rigorous testing So someone with migraines, if they have a history of cancer in the family, the doctor may think, okay, I'm very worried, so I'm going to be aggressive in terms of how much testing that I do. If someone does not have a history of cancer in the family, does not have a history of migraines, and let's say the social history tells the doctor that they just started a new job at the exact same moment the migraines occurred, maybe they would be less aggressive in testing. Okay, so these are the three different categories of medical history that we're looking at. Last but not least, medication. I don't know, I think it's pretty clear, but if you have something you want to add about medication, you can put it in the chat. Medication, maybe you can tell me, why does it matter to understand current medications? Why does the doctor need to know that? Because otherwise we're just looking at history. So why now? Why do we need to know that there's current medication? All right, Sarah says treatment interactions. All right, undesirable effects of drugs. We also have, we must look for diseases caused by a medication or medical procedure. Absolutely. Sometimes a medication can have an adverse side effect. I'm throwing in some vocabulary into the chat just for you to take with you. So an adverse side effect, adverse means negative. An adverse side effect, a negative side effect related to taking a certain medication. So the doctor absolutely needs to know, okay, you started getting migraines 3 weeks ago. Did your medication regime change? Your medication regime, meaning what medication you take at what times during the day, any other protocol that you follow. Okay, so we have that. We also have interactions. I see a lot of you talking about interactions. So if you, if the doctor wants to prescribe me a certain medication to alleviate my migraines, to make my migraines better, they need to know if the medication they're prescribing me will negatively, or hopefully it won't interact. Usually if we say it won't interact, it's a positive thing. Or if it interacts or it negatively interacts, it means that they're making each other worse. Either they can actually have a dangerous interaction in the body, or they can nullify. They can nullify the effect of the other, meaning cancel it. So if we take 2 pills and then we feel like we took nothing, neither pill works. This we would call nullifying. All right, great. I'm going to say the thing that I've said before, so I apologize if you've been here on some other weeks. But drugs is a lot of times too casual for us, and we often prefer to say medication. Drugs is, in English, it has a real association with illegal drugs. So like marijuana, cocaine, heroin. When people say drugs, that's the first thing we think about. It's not pharmaceutical drugs. So either we stick with saying medication or pharmaceutical drugs, So you put the entire phrase always together, or you can say prescription. But prescription is interesting. We use it, even though the doctor writes a prescription, we also will say, I picked up my prescription. And what we mean is I picked up my prescription drugs. You know, the prescription itself is just a white piece of paper, but we will use the word prescription to actually refer to the drugs themselves. So I will put that in there. Prescription. Yep, I hear you saying over-the-counter drugs, not on the counter, but over-the-counter drugs are fine. Absolutely. I understand what you're saying, that these are not illegal drugs. These are legal drugs prescribed by a doctor. But I just want you to know from an English standpoint that we rarely say drugs alone. We say medication, pharmaceutical drugs, prescriptions, over-the-counter drugs, medicine. Okay, we can say medicine, but medication is more normal. And Noelle saying pills. Absolutely. Pass me my pills. Much more common. listen to the difference here. If someone says, pass me my medication or pass me my pills, it's neutral. If someone says, pass me my drugs, it's almost, even if it's the same, we're talking about the same substance. When someone says, pass me my drugs, it's like they're bringing a negative opinion. It's usually what someone would say if they want to make a joke. So let's say you have, what's a flu medicine? What do people, okay, maybe it's paracetamol. Maybe we're back in the migraines and it's just paracetamol. It's basic, it's not addictive. Okay. But the person who's really sick goes, oh, my head hurts. Can someone just get me my drugs? Pass me my drugs. It's almost like I'm making a joke by pretending that the medication is addictive. You know, we imagine people who are addicted saying phrases like this, saying sentences like, pass me my drugs. Okay. So just, I want you to know that it has a slightly, it always feels like it's slightly referencing an illegal drug. I see Mohammed telling me there are also neuroleptics. Mohammed, you have surpassed my knowledge level. I don't know what neuroleptics are. Feel free to explain it, but it hasn't made its way into common medical terminology. Noel, pill is contraception. Very good question, Noel, actually, because it's a difference in how we say it, but it matters. So the pill is contraceptive versus pills. The pill is what people will talk about for birth control for women. Okay, I'm taking the pill or I'm on the pill. That's the preposition we use, to be on the pill. But pills is actually just a general terminology for medicine. Can someone pass me my pills? The doctor prescribed me these pills. So if you don't want to say medication, you're going to want to say pills before you say drugs. All right. Hossein is offering up painkillers. Yeah, painkillers, but only if they are in fact painkillers, because some pills are not painkillers, right? You can have medication that regulates your blood pressure. You can have medication that, here's where you know I'm not a doctor. What is a medication that is a pill that is not a painkiller? Antibiotics, of course, duh. Thank you, Yusra. Antibiotics, absolutely. So it's medicine, it's pills, but it's not a painkiller. This is why I'm happy to be in this class with medical professionals. Thank you. I think I had one more question. Haseen is asking about remedy. Can we say remedy? So remedy these days is really a term that we use for like home remedies. We usually hear these together, home remedies or homemade. And oops, remedites. Let's delete that. That's spelled wrong. Homemade remedies. So Noel is saying traditional medication. Sama says remedy is for a grandmother's recipe. Exactly. So, you know what? You tell me, what are some traditional homemade remedies in Algeria? When you were sick, when you were younger, you'd go to mom or dad or grandma or grandpa or tata or tonton, and you were sick. What would they tell you? Oh, chérie, you just need a little bit of, haha, that's what I thought. Olive oil. That's what I thought. Were there anything else? Anything else? Honey, very cool. Honey or olive oil herbal treatment. Lemon and honey. This I had growing up as well. Infusions, honey, herbal tea, oils, garlic, tisane, onion. Okay, interesting. Thyme, honey. These homemade remedies, these are things we pass down in our family. And even though a remedy as a word in English, it is technically a synonym for maybe a painkiller or a medication. It's not used in the pharmaceutical sense. Okay, I want to bring one more thing up. I'm just thinking of English tips as I see what you're putting in the chat. I want to talk to you about the use of the words tisane and infusion. So in English, especially American English, but you'll still find it in other English-speaking countries, we don't say infusion, we say herbal tea. So we consider it a type of tea. So if you're at a restaurant, you say, I'd like some tea. They will ask you, do you want green tea, black tea, or herbal tea? So they don't separate it. It's not tea and then infusion. It's everything is considered tea. And then you specify, do you have any herbal teas? Okay. So a very common homemade remedy are herbal teas. Great. All right, let us move forward. How to inquire about a patient's history. So we have a few different types of questions. So now you have to imagine we're back in the room. We have the doctor, we have the patient, and we're taking the medical history. So these are the types of questions you're going to be using. When? How long? Have you ever? Oops. And yes or no questions. So again, remember, this is a class on language. So we're trying to bring it back to the language that you use in a doctor-patient exam. So a yes, no question, for example, do you have any known allergies to medications, foods, or other substances? So this is often from a patient perspective, you feel like you almost can see the doctor on their clipboard, check, 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 check. They just have to run through a list of questions, figure out if the answers are yes or no. And usually the ones you answered yes to, okay, now we stop, we ask details, etc. But if you're just saying no, they're just going through their list. Another example, do you have any chronic medical conditions such as diabetes, hypertension, asthma, or heart disease? The answer is either yes or no. Then we have you ever? So have you ever is also a yes or no question. The answer to have you ever done something is either yes, I have, or no, I haven't. But the difference with have you ever is that we are going to say, if you say yes to it, we're going to pinpoint a specific time that you had this experience. Have you ever been hospitalized? If so, what were the reasons for your hospitalization? This is a little bit of a sort of medical slide that the doctors here, I'm sure, have been trained on more than me, saying that these yes or no questions are a way to get a full medical history, even when the patient is not talkative. So me, generally, I think I'm a talkative person, but when I'm a patient, I don't love to talk. I don't know if I want to be in the doctor's office. I'm not a huge fan of procedures, of testing. I know people probably agree with me. There's a group of us who hate going to the doctor. And then there's a group of, I won't say us because I'm not in it. It's a group of you all who love going to the doctor. So for those of us who don't love going to the doctor, these types of questions were designed so that by only asking for a short answer, the doctor still gets maximum amount of information. Okay. What about nonverbal communication? So here's a few little tips and tricks that are really going to be the element I was talking about at the beginning that touch a little bit more on culture. So in an English-speaking medical space, culturally, what's considered appropriate around doctor-patient interactions. So nonverbal communication, we have body language, we have a calm, composed demeanor. We have an open posture. So your body is open, your arms are not crossed. Gentle touch. So I would say generally speaking, in English speaking medical environments, touching is discouraged. It's not common except for a handshake. When you first enter the room and when you leave the room, you have a handshake. So we're not doing cheek kissing and we're not doing hugging. And generally, the body contact is very regulated. So the doctor will ask you at every step. Is this okay? They let you know ahead of time, okay, I'm going to put a cuff on your arm now. This goes back to what we talked about last week about the phrase informed consent, which I'll put back in here because it's a really important phrase if you want to work in an English medical environment, which basically means that anytime you're going to do anything with a patient, the patient has confirmed that they are okay with it. I hear Marazga saying it's the same thing here too. Okay, the same thing around body language. I mean, some of this I think is universal about if you want to have good communication in what is what can be, I'll say, I was going to say what is a somewhat stressful environment. In what can be a stressful environment for some, having a calm demeanor and an open posture will always help create more relaxation from the patient. Facial expressions. So maintaining eye contact, making and maintaining eye contact, showing attentiveness, smiling, a genuine smile, putting others at ease. And then we have this face here with a question. What's wrong with this doctor's body language and facial expression? Which I don't know if you've ever seen a doctor like this. You'll have to tell me if you think this is possible. I've never seen a doctor like this in my life, but it's true that sometimes the most brilliant of doctors, a lot of times this makes them scientists, are not always the best at these people engagements or these sort of the human side of things. So I want to hear about why. Crossed arms, lack of hygiene at the dentist. Are you thinking about a time that you have possibly bugged or annoyed your dentist because they find all of this junk in your teeth and they start to chastise you and tell you what you did wrong? Because that's absolutely happened to me before. Maybe the doctor in the emergency room, very serious. Nobody wants an appointment with her. Yeah, I definitely don't want an appointment. As someone who already doesn't like to go to the doctor, I definitely don't want an appointment with this doctor. She hates her job, burnout, not friendly. All right, well, we have here 2 areas that we identified an issue. I think you can see it as well, the cross language and the very angry expression. And a final little point on body language is just to say that it's also important to pay attention to a patient's body language to conduct a thorough medical examination. All right, now stay with me here because I'm going to go back to some slides that we didn't get to last week, because that wraps up our little bit on conducting medical examinations with patients. I'm hoping that we will be able to get some of you on the microphone. Oops, let me see here. Good. Let's go back. All right. Now I need to screen share again. If Zoom will let me do a screen share. Come on, Zoom. Beautiful. So we're looking back at the questions you would ask in the exam room. I realized we didn't finish this part. We did yes or no questions. We did have you ever questions. And then we went a little bit into body language. And now we're going back into the last section of questions, which is when and how long. So these are very common things we're going to use when we're asking about history. When and where did you have surgery? Were there any complications? When did you start experiencing symptoms? answers to these questions are going to be focused on time. So we included a little English thing here about adverbs of frequency. So when we're talking about time, we're talking about adverbs. We have one for you. One is always, another is usually. Can you tell me the other adverbs of frequency? These are words that we use when we're talking about how frequently something happens to us. Sometimes, rarely, frequently, sometimes and never, often, sometimes. I'm reading them out as they come in the chat. Often, often. Every day, rarely. Yeah, we could do every day, every hour, every minute, but I'm still waiting for one that I don't know if I see. Ah, yes, Sina already has this. I was thinking for never. So I'm seeing a lot of, oh, and here's another never. Thank you. All right, so always, usually, often, sometimes, rarely, and never. So these are the most common ones, okay? When we are talking about medical history, how often? So give me a question that you would imagine in a medical history with how often. That the answer to the question will be an adverb of frequency. Send it in the chat for me. What is an example of a question? Oops, oops, oops. What is an example of a question that's going to be with how often? How often do you feel nauseous? Great example. Perfect. So you have a patient in front of you who's experiencing nausea. How often do you smoke? Thank you, Yusra. That's very common. That's a common question because frequent smokers can have a lot of health effects. So doctors need to know, okay, you said you're a smoker, but what does that mean? How often do you smoke? All right. Yassine, how often do you experience back pain? Yeah, good. Just how often do you experience the pain you're having? I see a question here. How often did you become pregnant? Unfortunately, Noelle, we cannot say often for pregnant. You can say, how many children do you have? But we don't use that formula of how often with pregnancy, because often is really about the repetitiveness. So smoking is something that you can do every day, every hour. When you're sick, let's say, my migraine example, how often are you having headaches? Every 3 days, every 2 days? It's about that sort of regular interval. Whereas if you're talking about pregnancy, that's 9 months at a time. So it would only really work if you talked to someone in their 50s or 60s and said, how often were you pregnant? But still, we wouldn't say that like that. How often do you pass out? Sure. How often do you pass out? What does it mean, pass out? Who can send me? What does it mean, pass out? To lose consciousness. Cool. I'm looking for a simpler word. It's a one-word verb. What does it mean to pass out? Someone says to die, to escape. Nope. Faint. Thank you, Yusra. To pass out is to faint. It is not to die. It is not to die. It is simply, excuse me, it is simply to lose consciousness. It is not to fall into a coma. Passing out, well, actually, technically, to pass out is to faint. There's some people who pass out when they see blood. They see blood and they pass out. They faint. But we actually have a very informal way of using pass out. Has anyone, let me give you a sentence and you give me the synonym. Oh my gosh, I don't even remember going to sleep. It was so late. I think I just passed out on the couch. What do I mean? I think I just passed out on the couch. Fell asleep. Thank you, Amina. Slept rapidly. Well, slept rapidly, we can't really say. We just can say fell asleep. So passing out is an informal way to say to fall asleep, but in a medical context, to pass out is to faint. All right. Let's go back. How often do you smoke? How often do you experience back pain? Pregnant, we talked about this one. Noelle is saying not only pregnancies, but miscarriages. So again, we would not say how many, you know what it is? Maybe how often is with something less serious. I'm trying to figure out why it does not sound correct to me. So I'm hearing it as a native speaker, like we wouldn't say that, but I'm not sure why. It could be because they're very serious and we hope it hasn't been often. We don't want you to have had, 5, 6 miscarriages. Whereas often is like, imagine you say frequently or usually or always. This is something that happens with a high frequency. So in these cases with pregnancy and miscarriage, especially because there should never be, it's rare that you have more than, let's say, 10 in a lifetime of either. It's less and less common to meet women who have more than 10 kids. And I mean, I would hope that the situation of miscarriage also has a small frequency. So we're going to go with how much and how many. How many pregnancies have you had? How many miscarriages have you had? Okay. In these ones, we're not going to go with often. We're going to go with how many. Okay, let's see what else we have here. I've lost my place with my good how often examples. Thank you for the great participation, everyone. Mohammed is just giving me medical advice. Before prescribing antibiotics, check if there is a beta-lactam allergy. Thank you, Mohammed. I appreciate the medical advice. I see that some of you are sending your comments to everyone. Some of you are sending your comments just to host and panelists. So if you want to make sure everyone can see what you're writing, you're going to want to go to that little blue, it's a little blue square and it says to, and you can choose to everyone or just to me. So I'm reading them out loud in case other people needed that medical advice. How often do you pass out? Says wisdom. How often do you pass out? So for a medical question, it's a little too informal. I would expect a doctor to say, how often do you faint? Okay, we have a type of verb in English that we call phrasal verbs. Phrasal verb is something like pass out or hand off or wake up. It's a verb plus another word. And when you put them together, they have a new meaning. And they're very common. We use them all the time in spoken English, but they're also slightly less formal. So from a doctor, I would expect the more formal synonym, and the more formal synonym is faint. How often do you take your medications? Great example. How often do you cough? How often do you check your arterial pressure? So pressure is going to be French. So Sarah, I think that should be pressure. I think you want to say blood pressure. How often do you check your blood pressure? But correct me if that's not wrong. If that's not right, excuse me. Okay, great. Great examples. All right. How many times a week do you use your inhaler? Beautiful. We're going to go to the next slide here. We also have time markers. So time markers is just a fancy way of saying these words that are related to understanding time. So I won't make you guess them because it's not a very obvious category. As an English teacher, we use these. As an English speaker, you don't need to know this category name, but just know that these words are going to be coming up a lot when you're doing a medical history. Ago, since, last week, last month, last year. Okay? So let's do some questions with time markers. Any question, just come up with a question that either uses the word ago, that uses the word since, or that uses the words last week, last month, last year. All right, I have another question here. Do you have nocturnal symptoms or daily symptoms? So it's a great example, takfari nas. Thank you for this example because it's not quite correct and I want to show everyone why. So nocturnal symptoms means symptoms of a disease that you have in the evening or overnight, a nocturnal symptom. Daily symptoms does not mean symptoms that you have in the daytime. It actually means symptoms that you have every day. So daily has to do with frequency. We're in a frequency. Weekly means every week. Daily means every day. Hourly means every hour. So unfortunately, you cannot contrast nocturnal and daily. You'd have to actually just say, are these symptoms you're having at night only or during the day? During the day. All right, let's get my questions here. Since when did you start having these symptoms? Perfect. When was the last time you had a seizure? Great. Since when do you suffer from stomach aches? Plural. Good. Since when you have been vomiting? Okay, good, Sabrina, but I want you to remember in questions, we change the order. So in the answer, we say, you have been vomiting. In the question, we say, since when have you? Since when have you been vomiting? Good. Did you feel that a month ago? Very good. So if you're in the middle of taking a patient history and they say, I'm having this huge pain in my knee, say, okay, did you feel that pain a month ago when you went on that trip or that biking trip, or it started only recently? Noelle has a question. Do we say, since when did you have, or do we say, have you had? So these are different questions, Noelle. So let me start with the second one. Have you had? Have you had means, it's the same way of saying, have you ever had? Have you had equals have you ever had? Okay, these are the same idea. You're asking about the person's lifetime. When you say have you had an MRI? Have you had a specialist look at your lab results? Okay, if there's a more defined time period, then it would not be about lifetime. So for example, maybe you have something you've been struggling with. So let's take the pregnancy example. Maybe it's a woman who's really struggling to get pregnant and is having miscarriages. And the question could be, have you had fertility testing done? Although I suppose that still means have you ever had, but there's some circumstances where it might be more specific than your whole life. So those are yes or no questions. That was the first category of question we looked at. And then what was your second one? Do we say when, since when did you have? Let's see, since when did you have? No, so when you're working with since, you're also going to want to be in present perfect. Since when have you had? Although if I'm being honest with you, to sound fluent in English, we're not going to start with since. So let's go with, have you noticed anything different since you started exercising? Since is going to come in the second clause, okay? Since when is an unusual question format, except I saw someone who put a very good question. Hossein says, since when do we use pills to treat severe chest pain? So this question I really like. It starts with the word since, but it's actually very philosophical. Since when? Since when did we start using pills for this when we could have been doing lifestyle changes? In this format, it is common. In just really taking a patient history, you're going to find that since is usually coming in the second clause. All right, enough on since. Yassine says, how long ago did you start your medication? Yassine, it's great. How long ago did you start your medication? Nothing wrong with it. Good question. How many years ago did you undergo the surgery? Tak Farinas, beautiful question. How many years ago did you undergo the surgery? So, did you undergo the surgery? You can use the surgery if you are already in discussion about a specific surgery. But if it's more general, someone says, yeah, I had a knee replacement. You can actually drop the word the. How long ago did you undergo surgery? That's more common. How long ago did you undergo surgery? Maybe they'll say surgery on your knee. They'll specify, but it's rare that we would have it as defined. Warda, since when you've started the diet? Okay, remember what we're going to do in a question. The subject and the verb change places. Since when have you started the diet? And I don't really like it starting with since. I don't like since when. How long have you been on that island? I love that. How long have you been on that island? I don't know in what context a medical questionnaire would say, how long have you been on that island? But thank you, Sarah. You'll notice I changed in that island. I'm saying on that island. The preposition we use is on for this context. So I'm seeing a lot of questions coming in with since when. So I want to ask you, well, maybe I won't get an answer here. Since when have you had this headache? This is Noelle's question. Can I have an alternative? Who can send me an alternative? So the question we're working with is, since when have you had, so I'm editing it slightly, Noelle, to be accurate. Since when have you had this headache? What is another way to say this same question? I don't know if you're going to get it, but I'm going to give you 1 minute. Another way. I don't want you to answer the question. I want you to ask the same question. So you want the same information, but what is another way that we say this? Awesome. I have Sarah saying, how long have, okay, but you forgot the have. How long have you had this headache? Beautiful. And I have Mirazga. How long have you been suffering these headaches? Good. When did you have this headache? When did you get the headache for the first time? For how long have you been suffering? Beautiful, Amina. So what I was hoping to get you to, which actually seems like we have a great level in the room, is instead of going with since, we go with how long? Or really, for how long have you? For how long? For how long have you had headaches? Or let's do another example. How long have you been trying to get pregnant? Instead of since when, I really encourage you to go with how long. This is what we are using commonly in spoken English. All right, so let's talk about phrases to ask for clarification. How do you ask for clarification or more details if the patient's initial response is vague? So here are where we're going to talk about open questions. So before we talked about closed questions, a closed question is another way of saying a yes or no question. Okay, like, are you a smoker? That's yes or no. There's no details. Right? But now we need to have more details. This is when the doctor is really trying to make their diagnosis and they need to understand more about the patient. So here are some open-ended questions. Can you tell me more about that? What do you mean by, put a vague term. And then how has this been affecting you? Sarah is sending me another one. Can you elaborate? I love that, Sarah. I love that word. Can you elaborate? Also, tell me more. Tell me more is good. Tell me more about that. Could you please clarify? Okay, could you please clarify? All right, it's, well, okay, I was gonna say, type your questions in the chat. Sure. Give me a few more open-ended questions. Give me a few more. I just have an eye on the time, so we'll do it quickly. A few more open-ended questions, please. All right. Can you be more specific? Can you explain and give more precision regarding the topography of your pain? Well, if anyone asked me about the topography of my pain, I would not know what to say to them because that is not a layman's term. That is quite complicated. So I would just drop the word topography and say, can you explain me more about your pain and where it's located? Can you give me more details? Can you show me where it hurts? Okay. What do you mean exactly? For how long have you been feeling pain? Thank you, Warda. Good use of for how long. And also showing that these open-ended questions can kind of respond. So someone says pain and you follow up with them. Good. All right. Perform a physical exam. So actually, this whole time we've been talking about starting with taking medical history. That whole section was taking the medical history from the questions to the body language. So physical exams. So actually, a physical, when people in English-speaking countries are saying, I'm going to get my physical, they are talking about their annual doctor's appointment. So in spoken English, a physical is the annual doctor's appointment. Annual doctor's appointment. So it's one of these things that it started as a full phrase, a physical exam, and it quickly became a little bit slang, but now it is not considered informal really at all. I mean, you would see a 60-year-old man say he's getting his physical. So this is not young man's talk. This is really how we talk about our annual doctor's appointment. And it's interesting because at the physical, you actually do more than just physical exam. The physical is also when you meet with your doctor and you give the patient history and you ask your questions and you maybe make some decisions about your medical care. So a lot more happens than just physical checkup. Let's talk about essential terms and phrases that can happen during the physical part of your physical. So that's going to be blood pressure checking. They usually look in your eyes, looking in your ears, looking down your throat. So let's talk about language. First, what are effective ways to greet a patient and explain the purpose of the physical exam in English? These are just some different ways to start the engagement or the conversation in English, because what I hear a lot of from my students is a lot of, how are you? How are you? Again, again, again. But here are a few alternatives for how to start that interaction. So first, starting with an introduction. Hello, I'm Dr. whatever your name is. I'm not a doctor, but you can just put me in the scenario as practice. Hello, I'm Dr. Knight. Maybe one day I'll be Dr. Knight. And I'll be conducting your physical exam today. So please notice the verb. We say conducting a physical exam. We have, how are you feeling today? Or what, oh, we repeated one twice. No, I see. Wow, I completely didn't notice that. So how are you feeling today? But you can also say, how are we feeling today? Interestingly enough, how are we feeling today is it's just, I don't know why, but it's just slightly funny. How are we feeling? It has nothing to do with you. When you say we, you're not actually included. It's just a very sort of friendly way to talk to someone, and usually a very, in a funny situation, especially with kids. We would say this with little kids. Hi, how are we doing? Even to a little baby, you can look at mom and say, hey, mom, how are we doing today? All right, it's very casual. It's sweet. It can make the patient feel comfortable. Or what brings you in today? So these are not synonyms, right? Because how are we feeling is, yes, if you're sick, you can answer and say, I don't feel good. I don't feel good. But it's essentially a synonym for how are you? How's everything? How are we doing? How is life? What brings you in is a little more directed, just a little bit, really asking a question about what's the purpose of your visit. All right, then we have explaining procedures. So we're going back into the world of informed consent, where a lot of the language around medical English has a cultural component, which is that culturally we do a lot of verbal confirmation before we start even sort of basic procedures. So here's an example of someone explaining, I'm going to perform a physical examination to check your overall health. This will involve examining different parts of your body to ensure everything is functioning properly. As I'm sure you know, when you've gone to the doctor, there's always some verbal communication that happens before the procedure. They tell you, okay, I'm looking in your ears, I'm looking in your nose, I'm looking in your, I'm looking up your nose, I'm looking down your throat. So this is just another way of showing the language that can happen at that moment. And then we have questions about inquiring about symptoms. So when did you first notice these symptoms? That goes back to some of our questions we talked about before, where the answers will have those time markers. I've been noticing them since, just dropping things, since last week, since Tuesday, since I was 5 years old. It was 1 year ago that I started noticing the headaches, etc. And then we talked about this for those of you who are in the very first class, the scale of 1 to 10. And my students, some of you may still be here from the first class, reminded me, or actually wasn't reminded, it was the first time I heard that Algerian doctors actually do the same thing, which is asking people to rate their pain on a scale. So that if you come in with a complaint of pain, oh, my back is really hurting, doctors will ask you, okay, is it hurting at level 10, level 8, level 5, just to have a general idea of truly what degree of pain they're dealing with. All right, so we had a moment here of someone coming on the microphone to try. Do we have any brave souls? So here's the task. I will pretend to be the patient. I will have, how about I have an ear infection? Or no, I guess I wouldn't know I have an infection. Let's just say my ear is hurting and I'm coming to talk to a doctor. I want the person who comes on to introduce themselves, ask me how I'm feeling, ask me to rate it on a scale of 1 to 10. And then, I mean, of course, we can't do a physical exam because it's virtual, but we can go all the way up to the part where you say to me, okay, we're going to start an exam now. What do you think? If you are curious and adventurous, you will notice that you actually have an option to raise your hand. So raising your hand on Zoom, I'm going to lower everyone's hands just so that we're all on the same page. Raise your hand if you're curious and want to come on the microphone. We will not see your face, but we will hear your voice. So I want you, if anyone is feeling brave, to put up your hand and to come and pretend to be my doctor, who I'm visiting because I'm having an ear infection. All right, Yassine, I see your hand. Thank you very much. You will be our first one. All right, so I have welcomed you to the stage.
Okay.
And I see you're off mute. Can you hear us?
Yes, I can hear you.
How are you today?
I'm doing great, thanks. How about you?
I'm doing well, thank you. It's nice to hear your voice. I see you in the chat.
Yes, thanks. So I'm Dr. Fernini. I will be your doctor for today.
Okay.
How are you doing, Miss Ariella?
Not well. I'm not doing well. I have this really bad earache.
When did it start?
It started just 2 days ago.
Oh, okay. And have you tried any medication yet?
No, not yet. But I think I need to soon. It's really painful.
Okay. Could you maybe rate the pain from a scale of 1 to 10?
1 to 10. I guess I would rate the pain a level 7.
Okay, so it's a pretty nasty pain. Okay, so I'll be conducting a physical exam to have a closer look and see what's wrong.
All right. Thank you so much, Yassine.
So
great.
You're welcome.
Great job. Thank you. All right, I'm going to put you back on mute. Amazing. Well, that was a great first one. Oops, remove permission to talk, right? Beautiful. Okay, I've taken you off the stage. So as you saw with Yassine, I'll bring you on the stage and then I will take you off the stage for the next one. We have one more brave soul. I have Marazga. It says Marazga, no last name or first name. So I don't know if that's your first or last name, but I'm going to bring you on. And this time I will have, what shall I have? Oh, it didn't work. Oh, I think he's left. Well, that was my only other volunteer. Do I have anyone else who wants to try? Yusra says, I know nothing about ears. Well, I'm happy to give you a tooth pain if you want to come on. Amina, I see Amina is giving a hand. All right, Amina, a brave soul. Welcome. So you'll have to unmute yourself. So I've given you the permission. You can now unmute yourself. Can you hear us?
Hello.
Hi, Amina. Welcome to the stage.
Hi. How are you?
I'm doing well, thank you. How are you?
Alhamdulillah.
Amazing. All right, so I will let you go ahead. You start the scenario because you are the doctor.
Okay, well, welcome, miss. How are you doing? I'll be your doctor for today. I'm Dr. Amina. So I want to know what's bringing you in here.
Well, actually, I'm in a lot of pain, really bad headache.
What else? And since when?
Since when I've had the headache now for, let's say, a week, and it won't go away.
A week for like every day for a week, for a whole week?
Well, every day, but not the same level. So some days it's worse, some days it's better.
Is it worse or better at night, at day, or?
It's always at its worst at the end of the workday, like 4 p.m., 5 p.m.
Okay, so can you rate it from 1 to 10 or 0 to 10?
Well, right now it's maybe a 6, but sometimes it gets to a 10. It goes up and down.
Okay, so are you on pills or do you take any medication?
Yeah, I take a blood pressure medication. I don't know anything about it.
You made it harder.
I'm sorry. Okay, no, I'm on no medication. I'm on no medication.
It's fine. It's fine. It's fine.
Any more questions for me?
Mm, I just wanted to ask about other signs, other symptoms, perhaps.
Okay. What's the question?
Do you have other symptoms?
Other symptoms. Well, so if you ask, okay, I'm going to leave the scenario. If you ask me about other symptoms, it means I already know what the diagnosis is, right? So I think you have to say, do you have any other pain? Are you experiencing any other pain in other parts of your body? Does that make sense?
Please, can I ask a question?
Yes,
I mean,
please.
uh, as a teacher, not as a patient, okay?
Okay.
Is saying a symptom means that we are directed directly to a diagnosis.
Yeah, exactly. So a symptom is always of a disease. So when you say, do you have any other symptoms? It means we already know the disease and we know the symptoms. So we're checking. So let's say someone has like a urinary tract infection, and you can say, okay, do you have the classic symptoms? You know, is it burning? Are you feeling nauseous? Things like this. But if we don't know the diagnosis, we can't yet call them symptoms. You just say, are you having other pain? I can say, well, my stomach's been hurting, but I think it's unrelated. It's not a symptom of a disease. It's just, I think I ate something bad. That's the difference. Does that make sense?
Yeah, I got it.
Awesome. Thank you
Yeah.
so much, Amina. This was wonderful.
Thanks. Thank you.
Thank you. Thank you. All right. Amazing. I'm so happy to have had Amina and Yassine. Applause for our volunteers. Two things I really liked. I really liked, Amina, that you introduced yourself as Dr. Amina. I think this is a very nice way to introduce yourself to a patient by using the first name. It's very friendly. It's very, helps you connect. And Yassine, I really liked after you asked me my pain scale, when I said it's a 7, that you said, oh, that's a really nasty level of pain, or you empathized. You took that moment to connect with me and made me feel seen and recognize, like, yeah, actually, this is really painful. Amazing. Let me see if I have a few more slides I can get to before we have to close. We're a little bit past the hour, but we also started a little late. So a few more minutes here. These will just be some fast ones. I just want to go through common phrases for reassuring patients during physical. You're doing great. Everything looks good so far. This one is super common. Feel free to memorize this if you're working on using English in this type of casual interaction. This won't take long, okay? And I will be, or I'll be as gentle as possible, especially when talking about drawing blood or putting in an IV or anything that you know is going to cause a little bit of pain. During potentially uncomfortable procedures, on that same thread of causing a little bit of pain, you might feel a little pressure, but it shouldn't be painful. This part might feel a bit cold, but it will be over quickly. That's that reassurance part at the end. And if you need to take a break at any point, let me know. Don't hesitate to explain the reason why you're asking them, or I suppose in this case, why you are reassuring them. Okay, so this is very common in, I think, any medical environment, that the patient wants to know why you're doing what you're doing. So could you please sit up straight for me so that I can listen to your lungs clearly, explaining, I don't just want you to move your body around, I want you to do this so that I can complete my assessment or my analysis. Here's encouraging communication from patients. Please tell me if you feel discomfort. Let me know if you need me to stop or if something doesn't feel right. Don't hesitate to tell me if you're uncomfortable. Although I don't know about you all, but sometimes I've had dentists, in particular, the dentists come to mind. I'm sorry, Yusra, you said you were a dentist, but a dentist will say, please tell me if you feel any discomfort. And you're sitting there with your mouth full of like equipment and it's incredibly uncomfortable, but you're like, I know I have to get through this, so I'll wait till it gets really uncomfortable and then I'll say something. But I think we as patients understand that there will be some discomfort. All right, so I think we don't have time to come on the microphone and try anymore. Let me see, 8:05. I think we're gonna have to wrap up here in a second. Yeah, these are instructions for patients. Sit up straight. Can you lie down? Turn your head to the side. Take a deep breath in, breathe out slowly. Posture and spine, bend forward, arch your back. Really, I'm trying to think of the kind of terminology that you would need to use if you were providing medical care in English. So I hope this was useful. I think based on some of you coming on to participate with me, that you have a super high level, but it's still very good to figure out kind of what types of words or phrases or vocab we use at what moments. Before we close today, let's look together. Oh, no, that's wrong. It says our next session is session 3. We just finished session 3. We're gonna look together at the schedule. Here we go. So next time I see you all, see in quotes because I don't see anyone, but I see you chatting and now I'm starting to hear you. We'll be talking about prescriptions and managing medication. All right, so that will be next Sunday, June 9th at 6:30 p.m. So thank you so much for coming and I hope to see you next week. And we will be getting those presentations online ASAP. Thank you so much, everyone. Have a good rest of your evening.